Okay, we have time for a few questions. I'll start it off. With all this new data on bispecifics in early relapse, who do you choose gets a bispecific antibody versus CAR T?
Yeah, I think back up. Yeah, for me in my clinic, I think Darzalex has really been kind of what I switched to since really it came out in December. It's now in the NCCN guidelines. It's still off-label. It's not FDA approved yet, but we have been getting that, insurance approval for that so far. And I think, I would expect an FDA approval to come soon based on these pretty astounding data. But I think there are certain patients that, would be better candidates for CAR T. I mean, I think overall the efficacy for Darzalex, the safety is better, but maybe certain patients would prefer a one-off approach and be able to go through the risks of the added side effects from chemotherapy, from delayed neurotoxicities, which we do have protocols to prevent. So I think those are notable exceptions, maybe people that are referred to us from other providers for CAR T. I think that I usually try and respect their judgment on their own patients, So, and especially because maybe these things are not yet accessible in all locations and where we can do CAR T and then send people back. Am I answering your question adequately? Okay. Yeah.
First of all, great talk. And I have to say that AI makes you look so much muscular in a real world experience. But as somebody who doesn't treat myeloma, I wonder whether extrapolating from lymphoma. So one issue that we experience in lymphoma with bispecifics is that in the pivotal trials, the rates of negativity of the antigen at time of relapse were relatively low, about 20%.
Yeah.
But then in real world experience, they went up to 80% and above, meaningfully limiting our recycling of bispecifics or retargeting of the same antigen subsequently. Have you experienced the same with bispecifics and myeloma?
I think it's still early, and I think the testing is not uniform enough to know. We, don't have uniform, bone marrow availability to look at BCMA expression and mutations and all of these things yet. But what's been published is that they do happen. It's just hard to pinpoint exactly what frequency they're happening at, and maybe and then another level is when the point mutations happen, or they're often not been described before, so we don't know if those affect binding, or they just maybe happen in the binding domain or not. So it's a lot of guesswork, I think, and it's sometimes maybe trial and error of trying an agent for a patient before going on. But I think one real kind of interest of our lab actually is to try and discriminate between when patients get target-mediated relapse on their cancer cells versus T-cell exhaustion or dysfunction. So developing a way to kind of discriminate, and I think that's going to end up being maybe half and half. The people get relapse because their T cells just get tired of this kind of continued stimulation versus just losing the target. Because BCMA is pretty durable, and that's one of the great things that makes it a target in myeloma, is that it just these myeloma cells maybe helps their survival. They like having it around, so it's hard to lose for them. So yeah, I think there's a lot of directions to go, and your question is very appropriate, but we're still learning.
Thank you, Dan.
Okay, everyone. Well, this has just been a fantastic program. So appreciative of our administrative staff, all the folks outside who have been helping get ready for today, and with the registration on sites and all the little touches today. So thank you guys so much. I know you can hear me and really appreciate it. Just want to thank our wonderful speakers, particularly our guest speaker, for coming in from out of town, and all the fantastic talks today. I just have just want to make sure that everybody knows an email will follow no later than Monday with information on claiming your continuing education credit. And then just want to look forward to seeing everybody here next year for the 10th iteration of this great meeting. So thanks so much. Safe travels. Great to see everyone.